All right, good afternoon, everybody, and welcome to today's Team Kentucky update. We have got a lot to cover. We're going to start out with a lot of really good news. Today, based on our KEDFA meeting, which just recently wrapped up, I'm confident that this year we are or already have broken Kentucky's all-time record for creation of new jobs. We're still counting up the totals from the announcements, but we believe that we are over 17,000 new jobs today, and that does not include 1,400 temporary workers going to full-time Toyota members and jobs at places like App Harvest, which weren't seeking direct incentives. These jobs come with $11 billion in new investment this year, a number we crossed over today, which shatters any previous record for yearly investment. Put simply, this has been the best year for economic development in the history of Kentucky, and I believe that this role is only going to continue. It is truly exciting that as we sit here today, Kentucky is host to the largest investment in the history of both Ford and Amazon, and world-class companies are investing in us every single day. No longer a flyover state, but the destination that people trust with the most important projects that they have. So a couple of new announcements today. Consumer Cellular, Inc. provides cell phones and no-contract cellular plans for customers throughout the United States with a focus on low-cost options for customers over the age of 50. They've been around since 1995 and operate exclusively in the U.S., employing more than 2,400 people nationwide. Now, the company is establishing its first presence in our state with a $15.5 million investment to establish a customer support center. It's going to create 486 new jobs for Kentucky residents. That's nearly 500 jobs, and a vast majority of those are going to be created in 2022. The company will locate in an existing facility on Triton Boulevard, and positions created will include management and call center supports. This location in the city of Louisville is incredibly exciting given the new level of jobs that we will see. Consumer Cellular CEO Ed Evans noted Kentucky's low cost of living and high quality of life were crucial parts of his company's decision to locate here. We see these characteristics mentioned time and time again by company leaders who select Kentucky for their growing business. I want to thank Consumer Cellular for this investment in our state, and I look forward to seeing the company grow in our future. Here's a quick message from Dan Whalen, the company's Chief Financial Officer.
Hi, I'm Dan Whalen, CFO at Consumer Cellular. And on behalf of the company, I'm excited to announce our expansion to the Bluegrass State. I want to thank Kentucky Governor Andy Beshear, Mayor Greg Fisher, and their expert teams who helped make this possible. We look forward to doing business here. Thank you.
I think we wore the same thing today. We also have some good news for Eastern Kentucky. Now, we've talked about how exciting this year has been, and part of that excitement has been these jobs have been everywhere. We can point to almost every part of this state, nearly every community, and talk about exciting projects with exciting futures. Initially announced in 2020, the Martin County Solar Project took another step forward today with approval of state tax incentives to assist with the construction of solar energy generation facility on a former coal mine in Martin County. The project is under development by Savignon, which was established in 2019 and currently works nearly 90 solar projects and over 40 energy storage projects in 27 states. Company leaders anticipate the Martin County Solar Project will create 11 full-time jobs, including 8 in Martin County, as well as 250 construction jobs during the 12 to 18-month construction period. The planned more than $230 million facility will have the capacity of up to 200 megawatts, enough energy to power the equivalent of about 33,000 homes. So we want to thank Savignon for selecting the Commonwealth for this investment. And when you pair what's going on with Appalachia in Martin County, good to see investment in that community. Today, we're also announcing the expansion of Perfetti Von Mel USA in Boone County. Perfetti has operated in northern Kentucky since 1984, producing a variety of delicious candy products for customers through the U.S. and Canada. Folks with kids or a sweet tooth will recognize the company's well-known brands. Brands such as Airheads, Mentos, Frutella, and Chupa Chups. Now, the company will build on its roughly 460 employees by creating at least 16 new full-time production jobs with nearly a $10 million investment to add a new production line at its facility on Turfway Road. Perfetti has been an important employer in northern Kentucky for decades, and since 2017, the company's invested more than $35 million into its facilities in northern Kentucky so they could expand capacity, improve their infrastructure, and their technology. During that period, Perfetti has more than doubled its local workforce. Company's continued growth is great news for the region and for our state's thriving food, beverage, and agri-tech sector. So thank you to the leaders at Perfetti for once again making their commitment to Kentucky. Finally, on Tuesday, I had the opportunity to join executives from Four Roses and local officials to cut the ribbon on the distillery's new and expanded visitor center. If you're familiar with Kentucky's bourbon industry, you're familiar with Four Roses. The company has roots dating back to the 19th century and has consistently grown over the years to become one of the most recognizable names in this great industry. Our bourbon industry is where tourism meets economic development, and this project highlights that partnership perfectly. Bourbon is an $8.6 billion signature industry, providing more than 20,000 jobs for Kentuckians. And right now, there are more than 10 million barrels aging in the Commonwealth, or 2 barrels per Kentucky resident. The bourbon and spirits sector includes approximately 70 facilities in Kentucky, and since 2020, more than 30 new locations or expansions have been announced at over $600 million, creating roughly 500 new full-time jobs. Bourbon is on a roll. It continues to expand. That is good news for Kentucky, and congratulations to Four Roses. Now, I want to talk about an exciting project that impacts the future of our economy, but so much more than that. Decision that we collectively made a couple years ago, and thank God that we made it. In 2020, the General Assembly issued a $35 million partially forgivable loan to U of L Health to assist the company during its acquisition of Kentucky One Health. I remember being in these talks and negotiations about what it would look like and how it would work. The original loan agreement included a 15-year repayment plan beginning in 2025. I'm happy to announce that in response to positive financial performance, U of L Health will begin repayment earlier than expected, with the updated payment schedule concluding in 2025. That's right. They're going to pay off the loan before the first original payment was due. The loan has proven to be greatly beneficial for Louisville and the surrounding region. It has allowed for improved IT infrastructure, upgraded equipment and technology, additional beds, and other needs at U of L's health facilities in Jefferson County. Listen, we knew this loan would be vitally important, that we could not lose that Jewish hospital system. But my goodness, thank goodness we did this before the pandemic hit. With the doctors, their facilities, the beds, they were able to tend to COVID patients that otherwise could not have been helped. Think about it. We ran out of hospital capacity during COVID. We were overrun at a point that is still so difficult and raw for so many of us. This was a deal that was meant to be. And thank goodness we did it, because there are Kentuckians that are alive today that would not be here without this foresight. And it's gone incredibly well. With more than 7,900 full-time employees, U of L's Health Their role as a major employer in our state must be recognized. Their success has had a positive impact on all of us, and I couldn't be more excited. I could not be more excited and confident in the future of this system, having gotten to see their incredible work firsthand, including the very first vaccine that we all watched together a little more than 1 year ago today. So today, I'm joined by Tom Miller, CEO of U of L Health, and I'd like to invite Tom to share a few words about this incredible announcement.
Governor Beshear, thank you for the opportunity to highlight the success of our partnership. 2 years ago, we came to the Capitol to ask for support to preserve access to care and jobs in Louisville. Several local hospitals were in need of upgrades and investments in new technology and were losing millions of dollars. Jewish was on the brink of closure. U of L Health and the University of Louisville saw the critical need to save these facilities, and they had a tremendous dedicated group of nurses, physicians, educators, but it was not without risk. It was only with a $35 million partially forgivable loan from the Kentucky Economic Development Finance Authority and the support from local foundations, the Jewish Heritage Fund for Excellence and the Legacy Foundation of Kentucky, Indiana, that U of L Health had the financial resources to save these facilities, these jobs, and preserve access to health care. This vital loan would not have happened without the vision and support of a bipartisan leadership. Governor Beshear, Senate President Stivers, Minority Leader McGarvey, House Speaker Osborne, Minority Leader Jenkins. No one knew at the time that there would be a global pandemic, and without your actions, and the community would not have been able to care for the numerous patients that were ill. This was truly visionary. U of L Health thanks you, and our patients thank you. While I don't speak for everyone, I think the entire Commonwealth should say thank you to you. In just 2 years' time, with the help of this loan, U of L Health has turned around the once struggling facilities, and we're now in a position to pay off the loan 15 years early. While repaying the debt is good, the true benchmarks for success are measured in many other ways. U of L Health now cares for patients from every county in the Commonwealth. More than 5,000 jobs were saved, bringing our total to 12,000 associates who are part of our team. We rebuilt the Jewish Hospital Transplant Program. We opened a 24/7 heart care program in Southern Louisville at Mary Elizabeth Hospital. We are increasing access, particularly in the medically underserved areas. We've opened 5 urgent care centers. 2 are located in underserved areas. We opened 2 new locations for the Brown Cancer Center. 1 is in an underserved area. And we've recruited 107 physicians to support access to these underserved areas. 2 new hospitals are underway, an additional Fraser Rehab Hospital in Brownsboro, and we're also evolving our Bullitt County Medical Center into a full-service hospital that will begin groundbreaking next week. All that happened in the midst of a pandemic, and with the hard work of over 12,000 associates. I cannot say enough about our healthcare providers and the dedication they have shown. When many people were staying at home during the pandemic, this group came to work every day to take care of those in need. And I just have to say thank you. In addition to the support for this loan, I'd like to thank the governor and Dr. Stack for their leadership throughout the COVID pandemic. Your passion for health in the Commonwealth must be recognized and appreciated. And to anyone listening, I would leave you with one last message. If you haven't had a vaccine, please do. If you've had the vaccine and haven't had a booster, please get your booster. Let's make sure that our focus is the health of the entire Commonwealth. Thank you, Governor.
Not every day that someone pays off their loan 15 years early. So thank you for being such a good steward. Thank you for taking care of our people. Thank you for being a great teaching hospital that ensures that we have great healthcare heroes moving into the future as well. So a big day for U of L Health. The day I know there's a lot of other news going around, but this is really big news. Also, just got the confirmation text from Secretary Larry Hayes. We have, indeed, they can now confirm broken the all-time new jobs record for a single year. I want to congratulate Secretary Hayes and his group. I believe he has proven that he is the most successful Secretary of Economic Development that we have had, and we are grateful for all of the effort that so many have put in. Yesterday, we had the honor of welcoming some social workers here in the Capitol to help shine a spotlight on their crucial work. To address troubling reduction in their ranks, we announced a 10% pay hike, a plan to expedite hiring, and a loan forgiveness program. Today, I'm looking to another critical class of Kentucky workers who we need more now than ever, our heroic nurses. Even before the pandemic hit, nursing shortages were a problem. Now, the Commonwealth and the nation are experiencing a dire shortage. This threatens not only the health of patients, but the entire healthcare delivery system. In Kentucky, we are operating 12 to 20% short of needed nursing volume. Looking ahead, our state's projected to need more than 16,000 additional nurses by 2024. Given this set of facts, today, I'm going to sign an executive order declaring Kentucky's nursing shortage in the midst of a deadly global pandemic and emergency. Throughout this order, we'll address some of the barriers to allowing Kentucky nursing schools to enroll more students. It will require the Board of Nursing to approve requests for enrollment increases for schools that show sufficient resources to handle more students. This will help get more educated, trained nurses into healthcare facilities to help our students. The executive order also requires schools to report vacant student seats to the Board of Nursing every month. The board's going to post those vacancies on their website. That's going to let people know where there are spots open, and the order will also require that any school that is at full capacity that gets an applicant that is qualified to refer them to a school that still has vacancies. It's also going to require any school that believes that it can't meet its current allowed capacity because of faculty to provide a list to both the Board of Nursing, the Governor's Office, and the Council on Post-Secondary Education, so we can work right now to ensure the faculty is found, the people are hired, and ultimately we have the full capacity that we need to crank out more good nurses. Also under this order, existing schools that want to open new campuses can do so more quickly, again, as long as they have sufficient resources. Under this order, a new campus will be considered an enrollment increase to an existing program, which offers significant savings of time and money. The executive order also allows nurses licensed in other states to come to Kentucky and practice during this emergency, something that we have been doing. Further, it creates the Team Kentucky Nurse Advisory Committee, which will be composed of individuals with experience in education, healthcare, and nursing to propose additional solutions for addressing Kentucky's nursing shortage. These proposals will come directly to my desk for consideration. With this executive order, combined with my recommendation that all of our nurses that have been working in this pandemic for the 2 years that we'll experience of this pandemic will be qualified and included in our hero pay. You can also expect my next budget will have a loan forgiveness and/or scholarship program for nurses that agree to stay in Kentucky for a certain period of time, and working to address faculty loan forgiveness to make sure that we can have full enrollment at each of our schools. I want to thank a number of folks. First, we're going to hear in a minute from the Kentucky Board of Nursing, also the Kentucky Nursing Association. Everybody has been fully committed to addressing this crisis, and understanding that in the midst of a pandemic and in the midst of a shortage this dire, we've got to do things a little bit differently to make sure that we get the results we need at the time that we need them the most. So I'm pleased to introduce Kelly Jenkins, the Executive Director of the Kentucky Board of Nursing, for more about this order and its impact. And at that point, we'll sign the order. Kelly.
I just want to thank the governor for, listening to the voices of nurses with the KNA and through the KBN. The KBN has continued to work diligently to place these emergency orders in effect since the pandemic started. We've been working diligently to try to recruit more nurses from other states to come in. And also with our programs of nursing, we've tried to alleviate some of the burden with allowing simulation type settings for our students. It's been difficult for them to be in a nursing school, any healthcare professional school right now, and taking virtual classes. So we understand the importance of all those clinicals and the practice that they need. So we just want to thank the governor and working with us.
Always make me sign too.
Thank you. Do you want me to sign too?
No.
No. Okay.
It's just the Secretary of State's the other way.
Okay.
So with that order, we have declared an official emergency in the Commonwealth due to our nursing shortage. These are some immediate actions that we believe will provide some relief, obviously long-term. There is a lot to do. I want to thank the Board of Nursing for working with us and for working on long-term solutions at the same time that we take these short-term steps. There's also a portion in there about looking to expand those that can assist in our hospitals, which could be critical if we end up having another surge that impacts our ability, our capacity in those hospitals. So our goal has been to respond, whether that is the amount of law enforcement we are losing with our proposed raises to the Kentucky State Police, along with body cameras, the increase in the CLEP fund, which should help law enforcement and firefighters throughout Kentucky, what we've been able to do to assist social workers, knowing we have to retain and then ultimately recruit so many more, and today, steps to address our nursing shortage. Glad we are being active and that we are willing to try to make sure that we're doing everything that we can to not let these situations get worse, but in fact, to make them better. Okay, a little bit of COVID news. Today, just an hour before this press conference, the FDA greenlighted a request from Pfizer to allow individuals as young as 16 to get a booster shot. Now we wait for the CDC to weigh in before those age groups can receive that booster. Like adults, 16 to 18-year-olds would need to wait 6 months after their second shot. This is really good news. Waning immunity is real. We know we are seeing more breakthrough cases of fully vaccinated individuals the longer it has been since their second shot. I got a booster very publicly here. Everybody else needs to get a booster. I believe that it will be the number one thing that we can do to prevent another surge here in the Commonwealth. And we're seeing people go out and get them. Just this weekend, we had well over 45,000 Kentuckians get their booster shot. Yesterday, I'll have the number in a minute, we had over 10,000 Kentuckians get their booster shot. The news is really exciting about how well the boosters operate against Delta. That is enemy number one. It's certainly the deadliest variant to date, but it also now appears that the data will show that if you have had your booster, then you are pretty well protected against Omicron 2, where you might not be as well protected for preventing infection if you have only had the first 2 shots. So if you haven't gotten vaccinated, please do. And we continue to have people get vaccinated for the first time. If you haven't gotten your second shot, you've got to do that. The goal is to boost your immunity. And if you have had both, you should get your booster. You should get it before Christmas. Go out and get it as quickly as you can. So just yesterday, 4,363 Kentuckians getting their very first shot of hope. These are new individuals, still thousands every day, deciding to get vaccinated. About 4,800 individuals got their second shot, became fully vaccinated, and 10,351 people got their booster shot. That's now 664,339 boosters that have been given out in Kentucky. We continue to lead when it comes to boosters, especially in our fully vaccinated population. Our total number of Kentuckians with at least one shot now 2,712,835. A couple of changes in our demographic breakdown. Overall total still 61%. Remember, this has never been done in human history. To have a vaccine in less than a year, to have vaccinated 61% of every man, woman, and child in Kentucky, to have created a distribution network so robust that it can handle boosters or new age groups being added to it. It was the largest logistics challenge, and I believe the network is the largest logistics success since World War II. We ought to be really proud of it. Never been done before in human history, but it's not enough to defeat this variant. So while we are proud, we have to remain unsatisfied and continue to push, to slog, whatever it takes to get more people vaccinated and more people boosted. We did go up 1 point. Now 65% of all eligible Kentuckians, right? That's nearly 2/3 of every eligible man, woman, and child in Kentucky has received at least one shot. And those that make their own healthcare decisions, 72%, approaching 3/4 of everybody. You know, sometimes in the noise that's out there, people want to say this is one side or another. When you've hit 72% of all eligible, say, voters or those that make their own healthcare decisions, this is not a back and forth. It means the overwhelming majority of Kentuckians are doing the right thing, are listening to the science, and are protecting themselves and their families. So as we go down, I'll just go over the increases. 1 point up on the 65 to 74-year-olds. These are our rock stars when it comes to getting the vaccine. 95% of that group now having gotten vaccinated. The one other area it ticked up is 5 to 11-year-olds. That is now at 13%. Folks, I think we can do a lot better than that. This is an area that is an age group that is newly available to get vaccinated. Now, I think some more clinics will help with this, but please protect your children, protect your families. Let's switch to tourism. We have some terrific news today to tell you about our great tourism industry. As part of the Federal American Rescue Plan Act's Travel, Tourism, and Outdoor Recreation State Grant Program, the Commonwealth's been awarded $5.3 million to further position our expanding tourism industry to be an economic driver for Kentucky. Tourism is already an $8.9 billion industry for us, and it's a key economic engine in all 120 counties. To foster recovery of tourism in every corner of the Commonwealth, our Tourism, Arts, and Heritage Cabinet will directly award this critical funding to support destination marketing organizations in the Commonwealth's 9 tourism regions. Despite the challenges posed by the pandemic, I've been committed to supporting what is such an important industry, and especially with the outdoor tourism that we have in Kentucky. We are going to see more demand than ever. In May, we committed $5 million in Federal CARES Act money to help the Kentucky tourism industry to strengthen our promotional and advertising efforts by encouraging safe travel to all 120 counties. We also received $2.8 million in CARES Act recovery assistance grants to support economic growth in the tourism industry. Thanks to Mike Berry, Secretary of that cabinet, for all he's doing, but also everybody else who's out there working in and promoting our tourism industry. Thank you for showing the best of us. I don't think these great economic development announcements would have happened without you opening the door and showing the greatness that is our Commonwealth. All right, with that, a lot going on today. We'll open it up to questions. We actually only have 6 journalists. 2 are here in person. We'll start with Phil Pendleton.
They've been talking about how the Pfizer
So correct. What we have seen thus far are comments from Pfizer about very initial laboratory studies showing that the booster appears to be pretty effective against Omicron. They say that if you get the 2 shots, that there is less protection than against Alpha or probably even Delta, but that it is likely to prevent or reduce serious illness and disease. That's a good thing. That was our original goal of developing vaccines entirely. But really promising news that if you get the booster, they think it provides significant protection. What we have seen in every other instance in this is if the Pfizer data shows it, the Moderna data ends up showing it as well. Now, Moderna is a stronger dose that you got in the first shot, certainly in the second shot. So we'll see. But I expect Moderna to be at least as effective as Pfizer based on everything we've seen before against Omicron with the booster itself. J&J, we'll have to see. As you know, J&J was just 1 shot. If you got J&J, you need the booster more than anybody else out there. And you ought to go get it as quickly as you can. And I'd recommend talking to the professional that you're talking to about which booster to get. Potentially getting one even different than J&J. So make sure that you talk to the folks who are administering it or your doctor ahead of time. But it's really, really good news. The other potentially good news, and we haven't seen it yet, is that Omicron may cause less severe disease. It may, and we're still waiting to see this be milder. So remember, we talked about those 3 questions that haven't fully been answered. Does it spread more or faster? Is it more or less deadly? And then how well will the vaccines work on it? So all 3 of those will have to be answered for us to truly understand how concerned we should be. But at least some of the initial information is coming in a pretty positive way for Team Humankind as opposed to Team Omicron variant. Tom Latek.
Thank you, Governor. Speaking of Omicron, 27 states, I believe, now have had at least 1 reported case. How's Kentucky standing? So
I have not been notified of any case of Omicron in Kentucky. With that said, it's very likely here. And we will at some point get our first case. Now, the answer to those 3 questions still might impact when and how we get it. We are doing surveillance. There is a way in the surveillance to at least flag what may be Omicron or another different variant. But with all that said, let me go back to Delta is enemy number 1. Delta aggressively spreads. It causes serious disease. We had a 16-year-old on our death report yesterday. We have 40-year-olds on our death reports every single day. That's Delta. We know how deadly it is, and that's really, I believe, where our focus should be until Omicron convinces us otherwise. Karen Czar, WUKY.
Hi, Governor. Hello, Virginia. Thank you. Yes, can you hear me now?
I can.
Okay, thank you. So you took measures just now, obviously, to bring more nurses into the profession. But the reality is many are saying they're tired, they're done, they're leaving. Do you anticipate something that you've talked so much about is the importance of the hero bonus pay? Do you anticipate lawmakers will move quickly on this when they meet for session next month? Thank you.
So in my budget, you will see $400 million of American Rescue Plan Act dollars as essential worker bonuses or hero pay. It is to do a couple things. First, to say thank you. Thank you to these individuals who risked their own lives and bringing a deadly disease back to their family during this pandemic. It's also an incentive to keep going. And we believe that one of the main parameters is going to be that you've worked in that job, at least 2 years during this pandemic, which would be from March 6th of 2020 to at least March 6th of 2022. So something to look forward to. And yes, there is no possibility that our nurses aren't included in hero pay. And let me say it in a different way. my recommendation will be absolutely to include our nurses in the hero pay. We have a group of legislators that right now are holding hearings. They are moving fast on it. I think Representative Buddy Wheatley is leading that, and he is doing a great job. They have been reaching out to other legislators, inviting them to it, and we hope that we will see more participation as we go. But let's remember, once we get in, this isn't about process. This isn't about party. This is about the people that have kept us alive, kept us safe, kept us healthy, kept us fed, kept us safely in our home with our lights and our heat on during this pandemic. Saying no to this program is saying no to them. And I heard somebody the other day try to say something like, well, if there are so many people included, maybe it'd only be $1,000 or maybe only $500. Say that to some of our families. Say that to the social workers who help people get on food stamps and then sometimes because of their pay end up there themselves. $500 may be that next mortgage. It may be the difference in being able to afford both food and medicine. It may be the school supplies that our kids need, or them being able to go on the same field trips as other kids out there. It may be your out-of-pocket expense for your prescription drug plan. And it's also saying that we recognize you, we see you, and we know you are essential, and we thank you. Sarah Ladd, the Courier-Journal.
Yeah, thank you. So the Washington Post reported today that Omicron might lead to the need for a fourth Pfizer dose, so a second booster then. And of course, as you mentioned earlier, the FDA is authorizing boosters for the 16 and 17-year-olds. So I'm wondering if the focus on boosters rearranges the priorities of the vaccine messaging in the coming months or perhaps even year. And what I mean by that is, does it become more important at this point to make sure that vaccinated people are fully boosted, or is the priority still getting those first doses in the arms? Thanks.
Well, I think it has to be both. And it's a really good question, right? The reason that we vaccinate people is to build up their immunity enough to defeat COVID and any variant that's there. We now know to do that, we have to get them their booster shot. And so now it has to be our priority is to get people fully vaccinated and keep them there, right? So that is both getting people their first shot and getting them however many boosters we may need. Now, certainly, it's different messaging, right? We have to break through some skepticism or impediments to get more people signed up to get their first shot. But remember, every day, we've had over 1,000 people get their first shot, 4,000 today. So it is still happening. But we do have to have a serious and significant focus, especially at this winter time, if we want to prevent the next surge. If we want to prevent another surge, it's going to be boosters, in my opinion, that stop it, as opposed to new vaccinations because of the numbers. And because if we can get the 61% of all Kentuckians that have gotten vaccinated, or the 72% of all 18 and up Kentuckians that have been vaccinated, boosted, we crank up that immunity. There are going to be a lot less people that this virus can infect and continue to move through us. Corinne Boyer, WEKU.
Hi, Governor. Are the social worker raises permanent, and is it possible that the legislature could undo that?
The social worker raises should be permanent because they were based on a bump up in classification and fell under our current budget. Could the legislature undo it? First, I don't think they'll want to. I think they see the need here, and we've heard that from a number of legislators. But they set the amount of money that we have to pay social workers overall. Theoretically, could they slash that amount that's there to DCBS, thus resulting in us having to look at other options? Sure, they could, but I just don't anticipate that. In fact, I'm going to work very hard to not only address pay in this next budget, which we have certainly are already working on, but I'm going to budget more than 300 new positions because that's what it takes to get our caseloads down to where our children are adequately protected. And every year we say, but you're not going to be able to hire that many in this period of time. You know what we do? We undervalue both our social workers and our kids because we say that the goal is not attainable and we're not going to set aside the funds to get it done. So I think it's really important to have that full funding in there for the level of social workers that we need, even if we don't hit the mark in year 1 or year 2, that we have that in every year and it becomes a regular inclusion and priority in the budget. Melissa Patrick, Kentucky Health News with our last question.
Hi, Governor. The Surgeon General released an advisory yesterday addressing the surge in youth mental health issues since the pandemic. And I'm just curious what you see as the role of state government to address this issue and any suggestions you have to deal with the stigma that surrounds this topic as well.
Right. Well, listen, I'm the dad of 2 kids that have lived through this pandemic with me. And being a kid is harder today just because of social media than it has ever been. I mean, I remember being a kid and something would happen to you or somebody would say something and you think everybody knows. And now, somebody doing that same mean thing to someone else can put it online for the world to see. I've been attorney general when kids have done horrible things to other kids and videotape them and send it around thinking it was funny, and it's not. We've had more people lose parents or grandparents in this period of time than ever before, to lose school workers, to lose other people that they are close to. We're going to be in a period of collective grieving, facing mental health challenges as a people, as a country, and as a world, but certainly a focus on our kids is absolutely necessary. We've been able to direct additional funding to places like our Friskies, our Family Resource Center, for wraparound services, certainly needing more counselors, more assistance, more telehealth, so we can reduce the stigma of maybe being in the parking lot of that professional that we need to see. And I think we need to be having some direct talks to our youth about it's okay. Right? It's really, really hard right now. And talking to somebody can be really healthy, especially somebody trained to help us process those really difficult emotions. Our kids have been through a lot, but I also think that they are a bright guiding light for the rest of us. I think that they have set an incredible example where they don't feel sorry for themselves. They'll put on the mask. They just want to go to school, push through this, be with their friends, and have as normal of a life as they can. And they're going to be a special generation, right? We're going to have to address the mental health challenges in front, but they're going to be the first generation I can remember that have actively worked to save lives and have given up things early in their life to help other people. I think they're going to carry that goodness with them, and we're going to see amazing things out of them. Speaking of amazing things, we're going to end today with an amazing person. Recognizing a Team Kentucky All-Star is always an exciting moment, but today it's pretty special. Today I'm proud to honor Michael Dossett, Director of the Kentucky Division of Emergency Management, who is retiring at the end of this year, despite pleas for him to stay after his career of over 44 years of public service. He spent every day of his life working to save lives, and he's been up at this podium repeatedly, whether it is for severe weather or how we address this pandemic. He's not just an all-star, he is an MVP. To have his leadership in the midst of this pandemic has been nothing less than extraordinary. Michael has been primarily behind the scenes, ensuring everything from the resources for a field hospital to all the work of our regional emergency management and so much more in the midst of all of this. Michael is that call that when it comes in, I know something is going on, but I also know that we had a steady hand there to help get us through it. He's worked under 4 consecutive governors, but 2 had the same last name, and held senior advisor positions for the last 16 years in state government. Previously, Director Dossett served the Louisville Police Department for 28 years, retiring as an assistant chief of police. He is going to retire at the end of this year and transition to a position as the director for the Consortium of Emergency Services Technology Group, a division within the 8-state Central U.S. Earthquake Consortium. He plans to assist other non-governmental organizations with a focus on emergency services, and I bet anybody who reaches out for those services will benefit greatly. Not sure that counts as a full retirement, but Commissioner Dossett, Director Dossett, I'm really grateful. We've been through a lot together these last 19 months, but you have always been there. You've been incredibly steady. You have helped so many people in this Commonwealth, from flooding to COVID to just about anything else. This Commonwealth loves you. We appreciate you. Congratulations on being the Team Kentucky All-Star and MVP. Come on up. The people of Kentucky would love to hear from you.
Thank you, Governor. So, as most of us know, government service is a calling, and I am so fortunate to have been able to serve in a long career. Thank you, Governor. I am certainly appreciative of the opportunity to serve on Team Kentucky. The COVID pandemic has been the challenge of my professional career, and that includes all of my careers. This has been an event that we have all struggled with, but we've all pulled together, and thank you to your leadership, Governor. We've all moved in the right direction, and we're moving past that. So thanks to the staff of the Kentucky Division of Emergency Management, our group of remarkable, dedicated professionals came to work every single day. We actually activated the State Emergency Operations Center for 462 days in a row for the COVID response. So thank you to our staff who work diligently, and they work in blue skies and gray, just like all of our emergency services responders do. So during the past 22 months, we have endured a great deal, including the COVID pandemic. We were faced with a flooding event in February of 2022. In the following year, this year, we were faced with the second largest ice storm that the Commonwealth has ever been impacted. And 3 weeks later, one of the largest flooding events that we have ever sustained in the Commonwealth, all during the COVID event. I've worked with so many dedicated emergency services personnel. I'm grateful to so many, for Governor Andy Beshear for his steady leadership in the face of a global pandemic, our Team Kentucky Cabinet and ESF partners, our Kentucky Department of Public Health, supporting them throughout this entire event, our healthcare heroes, our Kentucky National Guard, our local EM directors, the ground folks, the folks that work every day out in our counties, our elected officials, colleagues in our other sister states that have assisted Kentucky. Thanks to all who have helped Kentucky become a safer and more secure environment for our communities and our citizens. So ironically, as I leave today, I will perform hopefully one of my last official duties, and I will draw your attention to the severe weather we're going to have this weekend, Friday evening into Saturday morning. So please be aware of that. Thank you again, Governor, for all of your support and your leadership. It's been my pleasure.
Thank you, my friend.
Thank you, sir.
Now we wish him the best. Oh my goodness, what a great member of Team Kentucky. And I have your cell phone, so I know how to find you. Thank you, everybody. We'll be back on Monday. Thank you to Virginia. It is always great to be the Robin to your Batman, and we'll see you next time.